Okay, so welcome to Plastico Review, and we're going to go through the latest papers on aesthetic plastic surgery of the face and eyelids for the month of February 2017. And we're going to start off with a very interesting paper by Rod Rorick and James Stuzen and colleagues regarding male ritidectomy or male facelift. No? So I think this is a very interesting paper. They actually went through 84 male facelift patients, and they compared them to 84 female facelift patients, regarding their complications and results. They didn't have any significant difference in terms of complications. They did have a slightly higher incidence of hematomas in the male population group versus the female population, but nevertheless, really no significant differences between both groups. Now, what's interesting about the paper is that it really goes through the differences you might encounter between a male and a female patient in regards to the way you will perform the facelift procedure. Basically goes through, the thickness of the skin, the laxity in the neck, the atrophy in the central face, the flatness of the brow, and especially the pattern of hair-bearing skin in the face. Different aspects of the facelift procedure that should be accounted for when performing it in males. A very interesting read. It really goes through the evolution and refinement in over 20 years of practice on facelift surgery in the male population from the author's perspective. So, I think it's a very worthwhile paper to go through. Now, going on, I'm very happy to review this paper. I think it's going to be a landmark paper, probably, definitely. It's the paper by Mario Pellicirabolo on his famous LSD technique, lateral skin platysma displacement. Basically, what Mario has done is outline his technique to avoid opening the neck in selected cases where he is able to achieve long-term results in terms of avoidance of recurrence of platysmal bands going through the lateral neck, and instead of separating the skin from the muscle, just pulling them together. But he does do a complete transection of the platysma muscle, and what he does is use spanning sutures to anchor this muscle to the fascia of the sternocleidomastoid muscle. He also does removal of the submandibular gland through the lateral approach. This is very interesting. This is actually described before on Clinics in Plastic Surgery paper by Raul Gonzalez, the excellent Brazilian plastic surgeon. And his technique is referenced by Mario Pellicirabolo, and it differs quite a bit from Mario's procedure. Also, Raul only proposes to remove 1 centimeter of gland, and Mario will remove, and of course from some of the pre-post-op pictures, which are excellent, by the way, you can see that he has removed in some patients quite a bit more than that amount that Raul Gonzalez proposes. Definitely, again, a very interesting paper. I've tried the technique. It really works well in selected patients, and it does not avoid in a lot of, heavier necks where you need to do some anterior subplatysmal work, like, digastric muscle reduction or getting a more contour definition by handling the, doing a hyoid release or removing, with direct excision, the subplatysmal fat. And even Mario Pellicirabolo, acknowledges that he does not use his technique in all patients. Maybe 10% he does need to go ahead and open the neck. So, something to consider in patients that may be candidates for not opening the neck. Probably patients that have thinned out and don't have a heavy, thick neck. And excellent, again, the discussion by James Stuzen. I think the discussions that Stuzen is making on some of these facelift papers I think if you put together the discussions from Stuzen from the latest papers on PRS regarding facelift and neck lift, I think you end up with all you need to know about facelift surgery. So definitely you should read not only the paper by Pellicirabolo, but again, the discussion by James Stuzen. And actually there's another paper which I think that may have a lot to do with face and neck surgery. It's actually on the experimental section of PRS this month, and it's by Michael Longacre's group in California. And it deals with the exodermal tissue remodeling in vivo. He's asking, does it settle? I think this is an amusing paper by Longacre, and probably it's more geared towards, dog ear settling after abdominoplasty. But certainly in the neck, it has a lot to do with the results you can get, because many authors, probably Feldman is the one who proposed it most, he does not advocate probably removing any tissue in his neck lifts, and he says that, all that tissue just settles in. You don't have to remove anything, even after aggressively removing, fat and subplatysmal tissue. He proposes a very extended undermining of the skin from the platysma muscle, and argues that the skin will just settle by itself without having to remove. So, I think Longacre should be commended for trying to discover the science behind this skin settling, and certainly, it's a preliminary paper in animals, but it's certainly a very interesting read. Now, the next paper on facelift is actually an anatomy study done by Vicky Sharma, Chris Zurich, and colleagues from Kansas City. The illustrations are impressive. They've made the cover of PRS this month. Actually, Chris Zurich already made the cover of PRS with another illustration with Javier Beut from Mallorca on the fillers for the mid-face. So, definitely congratulations to Zurich for putting up this excellent anatomic studies with excellent illustrations. And the paper itself, it deals with the lobular branch of the great auricular nerve and its implications for facelift surgery. I think it's an interesting read. They performed an anatomic study regarding this branch, which they consider that is just as important as the posterior and anterior branches of the auricular nerve, regarding avoidance of its injury in dissection of the flaps for facelift surgery. And they bring up a very interesting danger zone with the tragus and antitragus going to the McKinney point in the neck, where this branch is almost always encountered in their anatomic studies. So, congratulations. It's a very, very interesting paper and a very worthwhile read. Now, regarding eyelid surgery, there's a very interesting paper by Dr. Taban from Beverly Hills regarding performing lower eyelid retraction surgery, avoiding the use of spacers. Now, we all know that oftentimes, a mild lower eyelid malposition may be solved with just a regular cantopexy and scar revision. But definitely when there's a larger case of lower eyelid retraction, most of us will eventually see the need to use a spacer, which might give problems in the long term in terms of, inflammation, palpability, or lack of integration of the acellular edemal matrix or spacer in the body. Dr. Taban basically advocates the use of a mid-facelift and cantoplasty and scar lysis to be able to achieve a correction of the lower eyelid malposition without the need to use a spacer. Now, this is a preliminary report on only 11 patients with a short post-operative follow-up of an average 7 months. Now, I think what's interesting is really the discussion papers or the commentaries that are written following this paper by Guy Musry on one hand, where he even comments on the globe recession procedure through an orbital decompression to improve lower eyelid malposition. This is actually very, quite interesting. It seems like a very large procedure to perform to solve lower eyelid retraction, but he does say that he can perform it in about an hour, and it is not such a difficult procedure to carry out. And also a very interesting discussion by Richard Scon and Naresh Joshi, which is very experienced oculoplastic surgeons in UK, also commenting on their management of lower eyelid retraction. So, very interesting read on a very complex problem, which is lower eyelid retraction. And all three papers, the initial study and the two commentary papers, are definitely worthwhile reading. And that's all. That's all for facial aesthetic surgery and eyelid surgery for the month of February 2017. I hope to see you next month on the latest news on aesthetic plastic surgery in Plastica Review. Thank you.